Welcome back to this next video in which we are discussing influenza. Okay, so in this video we're going to discuss the treatment of influenza. So we'll start by discussing the antiviral medications, then what we'll move on to is discussing the symptomatic treatments for influenza, which are just to relieve the symptoms. So we'll discuss paracetamol, aspirin and ibuprofen. Okay, so let's begin then with the antiviral medications. So you will notice that I have brought us back to the portion of the page where we were discussing the replication cycle. And the reason I've done that is because the antiviral medications are going to work by interfering with the viral replication cycle. So I'll just come down here where we have a bit of space and I'll put the title. We are now going to discuss the antiviral medications. I'll just call them the antivirals. Okay, so an antiviral medication is any medication that is going to interfere with a viral infection. Now, of course, there are loads of different viral infections, and there are drugs against those different types of viral infections. We're specifically interested in the anti-influenza drugs, the antivirals that are targeted against influenza. And we're going to see two classes of antivirals that are effective against influenza virus. So let's do class number one then. So class number one is the neuraminidase inhibitors, and these are the antivirals against influenza that are more commonly used. Now I should just say something about the antiviral medications and when they're actually used. Anti-influenza viral medications are not regularly used. For most young, healthy people who get influenza, who get flu, they do not need to take antiviral medications. And indeed, if they did take antiviral medications, it wouldn't hugely help. It would speed up the recovery a little bit, but the risk of side effects is considered greater than the benefit that you get from actually taking the antiviral medication. In young, healthy people, you will win the fight against influenza almost certainly, and therefore you do not need to take an antiviral medication. Yes, it will increase the speed with which you recover, but we consider the risk of side effects to outweigh that benefit that you would get from taking the antiviral medication. So these are not given to normal, young, healthy people who get flu. These are given to people who get flu and who we do not think will actually recover, who will get instead secondary bacterial pneumonia or primary viral pneumonia from the influenza, and who won't beat the infection on their own. So elderly people who get flu, immunosuppressed people who get flu, those are the people who we're going to give antiviral medications, these medications that we're about to discuss too. So you will not normally see these prescribed to most people who have flu, and they should not be prescribed to most people who have flu because they do carry risk of side effects, and for most people you will get better from flu on your own, and it's better to just go with that and accept that you're just going to have to wait it out rather than take one of these medications that could have some horrible side effects. They're not as safe as the antibiotic medications. Okay, so neuraminidase inhibitors then is the first class of antiviral medications, and of the antiviral medications that are used against flu, these are the ones that are still actually used. I have seen these prescribed. I have not seen any of the drugs in the other category prescribed. However, regardless, they have interesting mechanisms, and therefore we will still learn about the other class of drugs. So, the names then of these medications, so let's get some interesting colour, bright purple here. So there are two neuraminidase inhibitors. The first one is Oseltamivir, and this has a brand name that is more famous. So Oseltamivir, it's an M there. Oseltamivir. So the brand name of this, that's the generic name. The brand name of this that is very famous is Tamiflu. So when you hear people referring to Tamiflu, that is Oseltamivir, the drug Oseltamivir, produced and marketed by a certain drug company. Okay, but that's the name that people famously know for this medication. So Oseltamivir is one example of an anti-neuraminidase drug that will inhibit neuraminidase. And the other example of a neuraminidase inhibitor is zanamivir. And again, this has a more famous brand name. So zanamivir is the generic name, and the brand name is relenza. Okay, so how do these medications work? Well, it's kind of obvious, isn't it? They are cyanic acid analogues. So they are molecules that are very similar to cyanic acid, and they can go into the active site of the influenza A virus neuraminidase enzyme and also the influenza B virus neuraminidase enzyme, and they can block that enzyme from functioning. Now, if that enzyme is no longer functioning, that's going to mess up the influenza virus replication cycle, because remember what neuraminidase normally does. Where is my picture of it? Ah, yes, here. When the viruses are budding off from the apical side of the infected columnar ciliated epithelial cell, remember that's when the neuraminidase enzyme is really important. Here they are, these little mushroom-shaped yellow molecules here. They, remember, cut off the terminal cyanic acid residues from glycoproteins and glycolipids on the cell membrane that they are budding off, to make sure that when they have budded off, they do not just bind and re-enter the cell that they came out of, because that would be useless. They don't want to infect a cell that is already infected, because that cell is close to dying. They need to find a fresh cell which they're actually going to be able to exploit to produce loads of new virus particles. So, if you give a drug then which inhibits the neuraminidase enzyme of the influenza A virus and the influenza B virus, then if we've got a host cell infected by influenza A virus or influenza B virus, then when the new virus particles are budding off, this won't happen. Neuraminidase won't function, and the hemagglutinin or molecules on their surface will now bind to those cyanic acid residues that are still there, and therefore they will re-enter the infected cell. So it really disturbs the replication cycle, and therefore is going to help stop the viral progression, stop production of more virus particles. Because if this virus particle that's just budded off goes back into the infected cell, it's not going to now produce thousands more virus particles, because this cell is going to die very soon. So it hugely reduces down the amount of viruses that we're going to be producing, and that means that the immune response has much more of a chance of actually eradicating the virus. These drugs will not destroy the viruses, they slow the viral progression down hugely, and they give the immune response a chance to actually annihilate the virus from the respiratory tract. So, that's category number 1 of antivirals. These two drugs, Oseltamivir and zanamivir, which are called also Tamiflu and relenza. And those are occasionally actually prescribed for people with flu who, for one reason or another, are not actually going to get better from this on their own, and if we don't do something, it's going to progress to secondary bacterial pneumonia or even primary viral pneumonia. Okay, let's now go to the second class of antiviral drugs against influenza, which are the ones that are of historical interest and are of mechanistic interest, i.e. their mechanism is interesting, but I have never seen them prescribed for influenza, and I don't think that they are generally prescribed anymore for influenza. If you want to give an antiviral drug for influenza, you give a neuraminidase inhibitor. Okay, so the second class are the drugs called the adamantanes. Now, their name is based on their chemical structure. Both of these drugs have a chemical structure that is described as the adamantane chemical structure. You can also call these the M2 ion channel inhibitors, and that actually describes their function, like neuraminidase inhibitors. So these drugs are going to inhibit the M2 ion channel, and that's how they are going to interfere with the viral life cycle. So M2 ion channel inhibitors. So firstly, let me talk about what an adamantane is, because this is actually quite an interesting chemical structure if you like chemical structures. So adamantane molecules all have the same core structure, and then they are just modifications of this core structure. So let me show you this core structure, and I'll try and squeeze it in this little space here. So we start off by drawing the 6-carbon ring, which is the center of the adamantane structure. So like so. So I'm drawing skeletal structure, of course. So here, this is supposed to be a hexagon, 1, 2, 3, 4, 5, 6 carbons. And now we're going to actually form 3 more 6-carbon rings, but we're not just going to have them separate. They're going to be intertwined with this one. So let me show you how this is going to work. So off this carbon is going to come another carbon here, and then off that carbon is going to come another carbon up here. Okay? So that's one carbon there, there's another carbon here. Now, off this carbon over here is going to come another carbon, which is here. And then this carbon's also going to be linked up to that carbon at the top there. So look what we've created there. Another 6-carbon ring is here. 1, 2, 3, 4, 5, 6. And we're going to create 2 more 6-carbon rings by just putting 1 more carbon onto this structure. Now, can you realise where I'm going to have to put this carbon in order to actually make 2 more 6-membered carbon rings? Well, this is a little bit of an IQ test. I can put it, and I'm going to do it in a different colour, otherwise it's not going to show up properly. I'll do it in red, so a contrasting colour. So off this carbon down here, we're going to have another carbon coming up there, and it's also going to be linked to that carbon at the top up there. So I hope this now makes sense. There's a carbon there that's linked to this one up at the top. This carbon and this carbon are also linked to that carbon at the top, and you can see that each one of these 3 carbons is then linked to these carbons of the 6-membered rings that are all separated by a single carbon in between them. And this creates us 4 carbon rings in total here. We've got 1 here, like so. We've got 1 here, over there. And then we've got the one that I pointed out here. And then, of course, we've got the original one there. So overall, 4 carbon rings. This chemical structure that we have here, this skeletal structure of this chemical structure, this is the adamantane core structure, and all adamantane molecules are then just modifications of this. This, with some interesting groups stuck off the side, is an adamantane molecule, and these 2 drugs in this class that are going to inhibit the M2 ion channel, specifically the Influenza A M2 ion channel. So strictly speaking, I should put AM2, and it does not work on the BM2, and it certainly does not work on the CM2 ion channel. So it's only influenza A virus that these are targeting, whereas Oseltamivir and zanamivir, they inhibit neuraminidase of both A and B species of influenza. So, these drugs are going to be adamantanes. Their structure is just going to be this core structure with a little bit of a modification. So let me give you the 2 examples of these then. So the 2 examples are amantadine and rimantadine. So here is amantadine's name written out, and then the other example, and I'll have it in another colour, we'll have it in, what colour should I go for? Lime green. The other one is rimantadine. So amantadine and rimantadine are both examples of adamantane drugs. They have this structure at their core. They're just interesting modifications of this core structure, and both of these can go into the M2 ion channel and block that M2 ion channel to block protons coming in. Now, why is that going to disturb the influenza A virus life cycle or replication cycle so much? Because remember how important the M2 ion channel is in the replication cycle. Remember, when the virus has arrived inside the cell, it's in the endosome here. And when the pH goes down inside the endosome, when it becomes more acidic, that is when the virus is triggered to go through this change that allows its genome here, these 8 pieces of RNA with all of their proteins attached, to actually escape from the endosome. So remember, the things that happen is the hemagglutinin undergoes a conformational change to bring out its fusion peptide, which is what fuses the viral envelope with the endosome membrane, but also the M2 ion channel is activated to open to allow protons in, which is what breaks apart the M1 shell and breaks apart the interactions between the viral ribonuclear proteins here and the M1 proteins. And if you don't break apart the M1 shell and don't break apart the interactions between the M1 proteins and the ribonuclear proteins, then these ribonuclear proteins are not going to escape from the virus. Even though the membrane will fuse, there'll still be an M1 shell around here trapping the ribonuclear proteins inside, so they won't ever get out of the endosome, and therefore they won't end up in the nucleus, and therefore the viral replication cycle is scuppered, basically. So that is how amantadine and rimantadine work, by inhibiting the M2 ion channel of the influenza A virus, and they're only effective against influenza A virus, not influenza B virus or influenza C virus. And hence, again, they don't kill the virus, but they slow it down, certainly. They will block a lot of influenza infections. Of course, they won't block all of the infections inside of the cells, because you won't take them in large enough doses that they will actually be in, every right position at the right time, but it will certainly slow down the infection hugely. And again, the idea is then that the immune system will be able to cope with this lower grade infection now. Okay, so those are the antiviral medications, the 4 anti-influenza viral medications: Oseltamivir, called Tamiflu; zanamivir, called relenza; amantadine and rimantadine. As I say, they are very rarely used. They're only used in people who will not get better on their own from flu. And to be honest, in elderly people, the way that we combat flu is with the vaccination program rather than with these antiviral drugs. Often with the vaccination program, elderly people can avoid getting flu most of the time. And with young, healthy people, you should not be taking these drugs. The risk of side effects from them is greater than the benefit that you will get from taking these drugs. Okay, but those are the antiviral drugs. Now let's talk about symptomatic treatment of influenza, and then we'll end the video. So I'll just put this as the title. So we're now going to talk about symptomatic treatment. So treatments that normal, young, healthy people who get influenza can take to relieve some of the symptoms of the disease. So the 3 drugs that we're going to discuss are paracetamol, ibuprofen, and aspirin. So the first thing I should say is that paracetamol has another name in the States and in many other countries in the world, and that other name is acetaminophen. So I'll just write this down here. So in Britain, we call the medication paracetamol. In many other countries in the world, including the United States, it's called acetaminophen. I have been brought up with paracetamol, so I will be referring to it as paracetamol throughout the video, but it is the same drug as acetaminophen. Okay, so that's one of the drugs we're going to discuss. The other 2 drugs we're going to discuss are aspirin and ibuprofen, and they are both examples of non-steroidal anti-inflammatory drugs, NSAIDs. So I'll put this here. So NSAIDs, this stands for non-steroidal anti-inflammatory drugs. People often get confused and say that paracetamol is a non-steroidal anti-inflammatory drug. It's not. Paracetamol is not anti-inflammatory. It does not have any anti-inflammatory effects. It's an antipyretic and it's an analgesic. So it's not a non-steroidal anti-inflammatory drug. It has a similar mechanism of action, we believe, to the non-steroidal anti-inflammatory drugs. So let me just write out this in full. So N and S stands for non-steroidal, AI stands for anti-inflammatory, and then of course D is just for drugs. So of course the steroid drugs, prednisone and hydrocortisone and triamcinolone and dexamethasone, they are incredibly powerful anti-inflammatory agents. These agents are non-steroidal. They are not steroidal in nature. And remember, steroid drugs are all characterized by having that core steroid structure. Much like the adamantanes, it's a similar concept. There is a core steroid structure, and all steroid drugs have that core structure within them. These drugs are not steroidal, but they still do have anti-inflammatory effects. So, the 2 major examples of non-steroidal anti-inflammatory drugs are aspirin and ibuprofen, and these are the ones that I'm going to discuss here. There are others such as indomethacin, diclofenac, naproxen, but the major ones that you can buy over the counter, and which many people do buy over the counter, are ibuprofen and aspirin. Okay, so these are the drugs we're going to discuss. Paracetamol, also called acetaminophen, which is not an NSAID, and then the NSAIDs, aspirin and ibuprofen. So, I'm going to start off with how aspirin and ibuprofen work, and then we'll come back to how paracetamol works. Paracetamol's mechanism of action is still controversial. We don't actually know how this drug that is used so often works, which is a bit of a shame because it, as I say, it is used all over the world continuously, and we don't really know how it works, but we think its mechanism is very similar to how these work. And therefore, I'll talk about how these work and then say a little bit about what we think is true for paracetamol. Okay, so another colour, we'll go for orange, I think. So, aspirin and ibuprofen, and indeed the other NSAIDs as well, diclofenac, indomethacin, naproxen, why do you take them in flu? What are they going to do? Well, their two major effects are that they're going to have an antipyretic effect. So this means that they're going to reduce the fever. So pyrexia is another name for a fever. So when you say you're pyrexial, that means you have a fever. Your body temperature is raised. So antipyretic means that they're going to reduce the fever, and indeed they do reduce the fever. And the other major effect is that they're going to have an analgesic effect. So that means that they're going to reduce pain. So the antipyretic effect is going to help relieve the systemic symptoms of having a fever, having chills and shivering, and it's certainly going to help relieve rigors. So those, remember, were 3 of the symptoms that we had in our list of systemic symptoms, if I can find it, and I'm very quickly regretting trying to find it. Here we go. So it will relieve these 3 systemic symptoms, the antipyretic effect. Pain-killing effect, well, that's going to help relieve the headache, it's going to help relieve the muscle aches, the myalgia, and it's also going to help relieve any local pain that you've got. So it's going to help relieve the sore throat, it's going to help relieve the pain that you get when coughing. Remember, with laryngitis and tracheitis, you get that barking cough where it's very painful, well, not very painful, but it's uncomfortable to cough, and the NSAIDs will help to relieve that pain. So they're going to help with the systemic pains, i.e. the headache and the myalgia, and they're also going to help relieve local pain as well. So I'll just put that here. So analgesic effect is going to help get rid of the headache. It's also going to help get rid of the myalgia and also the pains that are local to the respiratory tract, which I'll just call the local pains. Okay, so these are the 2 major effects that the NSAIDs are going to have, and this is why we take them when we have flu, because they're going to help relieve the systemic symptoms. Okay, so the next thing to ask is, how do they help relieve these symptoms? Well, remember what we said about the mechanism of where these symptoms come from. Local pain is caused by the synthesis of that molecule, prostaglandin E2, in the area where inflammation is occurring. Headaches and myalgia, why do we believe those occur? Well, remember, the cytokines, interleukin-1, interleukin-6, and tumor necrosis factor alpha, they go into the blood, they go, we believe, to the muscles and also potentially to the meninges, and then trigger the production of prostaglandin E2 there as well, and that activates the pain neurons as well, the nociceptors. So, these things are mediated by prostaglandin E2. In addition, prostaglandin E2 played a really important part in causing the fever. Remember, TNF-alpha, interleukin-1 and interleukin-6, they went up to a special nuclei in the hypothalamus, and I believe it's the anterior hypothalamic nuclei in the hypothalamus that control body temperature, causes the increased production of prostaglandin E2, and prostaglandin E2 then resets the body temperature to raise it up to maybe 38 or 39, and then that's what causes the fever, and then until you're up to that body temperature you feel really cold, you get the chills, and the shivering is there to try and bring your body temperature up, and if it gets really extreme and you're actually shaking, that's when we call it rigors. But the whole point is, it's all mediated by the synthesis of prostaglandin E2. So, aspirin and ibuprofen, and indeed all other NSAIDs, the non-steroidal anti-inflammatory drugs, they're going to inhibit the synthesis of prostaglandin E2, and therefore they're going to get rid of all of these symptoms that are dependent on prostaglandin E2. So, a little bit of biochemistry then. How do you synthesize prostaglandin E2? Prostaglandin E2 is synthesized from the precursor arachidonic acid, as indeed all prostaglandins are. So let's just draw a little flow diagram here. We'll have aquamarine blue back again. So the molecule from which all prostaglandins, so not just prostaglandin E2, but all the other prostaglandins you might ever have heard of, and we've mentioned one other in this video, which is prostaglandin I2, they're all synthesized from a carboxylic acid molecule, a long carboxylic acid molecule called arachidonic acid, which for short is abbreviated down to AA. Now, in the synthesis of prostaglandins then, arachidonic acid is firstly converted to prostaglandin G2, and then it's converted further to prostaglandin H2. So arachidonic acid is converted into prostaglandin G2, PGG2, and then it's converted into prostaglandin H2, and these two are the precursor prostaglandins to make all the other prostaglandins. Prostaglandin H2, this molecule here, can then be converted into the other prostaglandins. So for instance, this one can go to make prostaglandin I2, and it can also be used to make prostaglandin E2. So, overall, the message here is to make prostaglandins, the end prostaglandins, like prostaglandin I2 and prostaglandin E2, we firstly have to take this molecule, arachidonic acid, and convert it into prostaglandin H2, and this firstly involves you converting it into prostaglandin G2, which is then converted into prostaglandin H2. Now, both of those steps there, the conversion of arachidonic acid into prostaglandin G2 and the conversion of prostaglandin G2 into prostaglandin H2 are catalyzed by enzymes called cyclooxygenase enzymes. So, these reactions here are catalyzed by cyclooxygenase enzymes. And for short, cyclooxygenase enzymes are abbreviated to COX enzymes. So, cyclooxygenase enzymes or COX enzymes. And there are two major COX enzymes that are used in the body. These are COX-1 and COX-2. And as I say, they catalyze both of those reactions. A little bit more background knowledge, and I'm going to have to change colour because I hate that colour that I've managed to find here. Let's go to royal blue. I like royal blue. We'll go back to that. Okay, so these reactions are so important, the conversion of arachidonic acid into prostaglandin G2 and the conversion of prostaglandin G2 into prostaglandin H2, that they're even given their own special names. So for a bit more background knowledge, let me tell you the names of these reactions. So the first reaction, which converts arachidonic acid into prostaglandin G2, this is called the cyclooxygenase reaction. And I'm being a little bit indecisive here. Sometimes I will put a dash in between cyclo and oxygenase, and sometimes I omit that dash. And people do this all the time. You'll see sometimes cyclooxygenase written without the dash, sometimes you'll see it written with the dash. It was just me being incredibly indecisive there, that I've put it twice. Well, put it in the two different ways here. So this is the cyclooxygenase reaction. And the second reaction, the conversion of prostaglandin G2 into prostaglandin H2, that is called the peroxidase reaction. So the second reaction is the peroxidase reaction. Okay, right. So, summarizing what we've seen so far, to create any prostaglandin, such as prostaglandin E2, the one that we are interested in over here, you firstly need to start off with arachidonic acid molecules, which you get from the cell membrane. So all cells have arachidonic acid molecules. They can break down their phospholipids. They can break off some of the long-chain carboxylic acids in phospholipid molecules, and some of those will be arachidonic acid. So all cells have a lot of arachidonic acid that they can harness. So any cell can do this. So they can get their hands on this arachidonic acid, then they can convert this into prostaglandin G2, then into prostaglandin H2, and both of those reactions, the cyclooxygenase reaction and the peroxidase reaction, are catalyzed by cyclooxygenase enzymes, the main two being COX-1 and COX-2. Then, prostaglandin H2 can be converted into these final prostaglandins by other enzymes that it's not important for us to know the names of. I'm becoming a professional teacher. Whenever you don't know something, dismiss it as trivial. That's how you get through. Okay, so aspirin and ibuprofen, the non-steroid or anti-inflammatory drugs, the NSAIDs, they all work by inhibiting COX-1 and COX-2. So both of these enzymes, COX-1 and COX-2, they're going to be inhibited by the NSAIDs. So these work by inhibiting COX-1 and COX-2. So, overall, let me tell the entire story then now. So when you take aspirin and ibuprofen, what these are going to do is they're going to go all around the body and they're going to inhibit COX-1 and COX-2 enzymes all around the body. That stops the production of all prostaglandins all over the body, because whenever you produce a prostaglandin, this reaction has to occur. You have to convert arachidonic acid into prostaglandin H2. Now, as we'll discuss later on, there is another type of COX enzyme apart from COX-1 and COX-2, but they're the major ones. So you're hugely going to stop prostaglandin synthesis all over the body, or at least largely. Now, that means that all of these mechanisms which relied on prostaglandin E2, they're no longer going to happen. So at the site of inflammation, you're going to stop creating more prostaglandin E2, which means that the pain will be relieved. The amount of prostaglandin there will be reduced, and the activation of the nociceptors will go down. So that's why local pains are going to decrease. Also, the reason the fever is going to go away is that now, even though TNF-alpha, interleukin-1 and interleukin-6 are still going up to the anterior hypothalamic nuclei up in the hypothalamus, now they're not going to actually result in the increased production of prostaglandin E2. No longer is any more prostaglandin E2 going to be synthesized, or at least the amount of prostaglandin E2 that's being synthesized up there is going to go down. And of course, you have to understand that prostaglandin E2 does not live forever. You have to continuously make more of it if you want the symptoms to maintain. So where you have local pain, you have to continuously be producing more prostaglandin E2, because the prostaglandin E2 molecules that you previously produced as part of the inflammatory response, they will be broken down. And so if you want to maintain pain in an area that's inflammatory pain, you do need to keep synthesizing more prostaglandin E2. We have now blocked that synthesis of prostaglandin E2, so that's why the pain is going to go away, or at least it's going to be reduced. We've not blocked all synthesis of prostaglandin E2 because we don't give these drugs in large enough doses that they will block every single cyclooxygenase enzyme, but we will hugely reduce it, and therefore you will get relief from the pain. Again, going over the fever, interleukin-1, interleukin-6 and TNF-alpha will still be going up to the hypothalamus, but they will not result in as much production of prostaglandin E2 anymore, and therefore the fever is going to be relieved, the shivering is going to be relieved, the chills are going to be relieved. If you've got rigors, they're going to be relieved as well. With regards to the headache and the myalgia, interleukin-1, TNF-alpha and interleukin-6 will still be there, but now they're not going to result in the production of prostaglandin E2, or not as much prostaglandin E2 in the respective areas, the meninges and the muscle tissue, and therefore you're not going to get the pain that you got previously, or at least not as much pain. So this is the way in which these drugs, the NSAIDs, are going to relieve those symptoms, by blocking the synthesis of prostaglandin E2. Okay, now making a comment about paracetamol, acetaminophen. So its mechanism is not as well understood. We think it stops the synthesis of prostaglandin E2 as well, because what it does is so similar to aspirin and ibuprofen with regards to its antipyretic and analgesic effect. These have other effects as well that paracetamol does not have. These also have anti-inflammatory effects, but I'm not going to go into that. But with regards to the antipyretic and analgesic effects, paracetamol matches these two. But paracetamol is not a very good inhibitor of COX-1 and COX-2, so that is not the way that paracetamol works. So humans were looking for the answer. How does this wonderful drug paracetamol actually work? And we discovered that there was another cyclooxygenase enzyme beyond cyclooxygenase 1 and cyclooxygenase 2. There was another cyclooxygenase enzyme. There was the cyclooxygenase enzyme COX-3. And we found out that paracetamol is an absolutely brilliant inhibitor of COX-3. So everyone then said, "Whippy, we've done it. We understand. Paracetamol inhibits this other cyclooxygenase enzyme, so it will reduce prostaglandin synthesis. Prostaglandin E2 synthesis will go down in all of these sites, and therefore you will get the relief of the symptoms, you will get the antipyretic effect, and you will get the analgesic effect." Problem solved. The problem is it's not completely solved, because we don't think cyclooxygenase 3 is actually in the right places. We haven't really found it in these places that it would need to be in, i.e. like the skeletal muscle tissue or the local tissues where prostaglandin E2 is synthesized. So we don't really know whether this actually is the way paracetamol works. We were really hopeful when we found this enzyme COX-3 that it was the reason that paracetamol was effective. The problem is it doesn't actually seem to be in the tissues where the prostaglandin E2 is being produced that produces these symptoms, and therefore we can't explain paracetamol inhibiting this enzyme as the reason that it blocks the production of prostaglandin E2 in these tissues, because that enzyme we don't think is actually in those tissues. However, people still often quote this as probably the mechanism of prostaglandin E2. Maybe we will find that it is in these tissues, but at the moment there's a question mark around there and we don't really completely know how paracetamol works. But we do think it probably works by stopping the synthesis of prostaglandin E2 somehow, like the non-steroid or anti-inflammatory drugs do. Okay, so that is the mechanism by which paracetamol and the NSAIDs produce relief from some of these systemic and also local symptoms of influenza. The final thing that I would like to say is that these drugs are what most people, most young healthy people, if you get flu, these are the things you should be taking, not the antivirals. And the one that I would advise taking is paracetamol over aspirin and ibuprofen. These are more serious drugs than paracetamol. If you take paracetamol according to the set doses, it will not, or at least is extremely unlikely to cause you any damage, whereas these two are slightly more side effect prone. So, the final thing I'd like to do then is just give you the normal doses of paracetamol, aspirin and ibuprofen. These are some of the doses that all medical students should know off by heart. So, I'll just get a little bit more space than that. So, we'll start off with paracetamol, and actually I'll put them next to the names that I've already written out. So, paracetamol acetaminophen, what is the normal dose for this? So, this usually comes in 500 milligram tablets, and you can take 1 or 2 of them up to 4 times a day, so every 6 hours at the maximum. So every 6 hours, that's the maximum. You don't have to take it every 6 hours. Usually, when I have flu, I do not take paracetamol every 6 hours. I take it every 8 hours because I don't want to have to get up in the middle of the night to take paracetamol. And every 8 hours works better with my sleeping routine. So, paracetamol comes in 500 milligram tablets. You can take 1 to 2 of them. I often take 2 of them, and you can take them at the maximum every 6 hours, so 4 times a day. So that's the normal dose of paracetamol. Let's now go on to the normal dose of aspirin for the relief of flu symptoms. This is obviously a drug that's used for many other things besides relieving flu symptoms, and for different things it would be given in different doses. So this is the dose that aspirin is usually given in for flu symptoms. So aspirin usually comes in tablets that are 300 milligrams if you're buying it for flu symptoms. If you're buying it for heart attack or stroke prophylaxis, then it will be in 75 milligram tablets because you're going to be taking it long term, whereas for flu you shouldn't be taking it long term, you should just be taking it for a few days, and therefore you can take it in these higher doses. So aspirin usually comes in 300 milligram tablets, and you can take 1 to 3 of them, again up to 4 times a day, so up to every 6 hours. So you can do 300 milligrams every 6 hours, 600 milligrams every 6 hours, or even 900 milligrams every 6 hours. So that's the normal dose of aspirin for flu. And as I say, you should not be taking this long term at those sort of doses. If you're taking long term aspirin for MI or stroke prophylaxis, you take a much lower dose than that. And then finally, let's do ibuprofen's dose. So ibuprofen usually comes in 200 milligram tablets, and you can take 1 to 2 of them, so 1 or 2 of them, and you can take it up to 3 times a day, so every 8 hours is normally the routine for ibuprofen. So those are the normal doses for paracetamol, aspirin and ibuprofen. You can take paracetamol with either aspirin or ibuprofen or another NSAID. So you can combine them, but you must not combine NSAIDs together. Paracetamol, remember, has a different mechanism to these. These have the same mechanism, so you mustn't take them together because then they're going to have an additive effect, whereas these are targeting different things. If you combine NSAIDs, you risk them starting to cause gastric bleeding because, remember, they take away, by blocking the synthesis of all prostaglandins, they block protective mechanisms that the stomach has for preventing overproduction of stomach acid. So if you take too much of these, they can lead to the overproduction of stomach acid in the stomach, and the stomach can end up burning a hole in the side of its wall, and then you get bleeding of the stomach wall into the stomach, gastric bleeding. So it's a horrible side effect that can occur if you take too many NSAIDs, if you take too high doses of them for too long. So you should just be taking these for a few days for flu. You should not be taking them at these doses long term. And you should not combine them, although you can combine paracetamol with any one of the NSAIDs. Okay, so that is the treatment for flu, the treatment that normal, healthy young people who get flu should be taking. We've covered the antivirals, which can be used if someone is not going to get better from flu on their own. And that concludes my discussion of influenza. Very well done for making it through to part 18. I'm sure you've learned a lot from the video, otherwise you would have left long ago. Thank you.